Good morning or good afternoon, distinguished participants. On behalf of the organizer, I would like to extend a warm welcome to all of you. And we are pleased to have you here at the EANET Seminar on the effects of acid deposition and air pollution on human health and ecosystems, organized by the Network Center for the EANET. My name is Hiroyuki Sase, Head of Ecological Impact Research Department, Asia Center for Air Pollution Research, designated as a Network Center for the EANET. I am serving as a moderator of the opening ceremony and the first session. This 2.5-hour workshop aims at providing venues for all participants to obtain scientific knowledge on the acid deposition and air pollution effects on human health and ecosystems, to learn science-based policy experiences on the reduction of atmospheric pollutants in other regions, such as Europe, and to obtain a common understanding of future direction of environmental measures between policymakers and scientists on national and international levels. Firstly, Dr. Shiro Hatakeyama, Director General, the Network Center for the EANET, will give you opening remarks. Dr. Hatakeyama, the floor is yours.
Thank you, Dr. Sase. Ladies and gentlemen, welcome to the EANET Seminar for Acid Deposition, Air Pollution, Effects on Human Health and Ecosystem. In recent years, the general public's interest in the atmospheric environment has tended to focus on global warming and climate change. However, air pollution, including acid deposition, still remains as an important environmental issue. Its effects on human health and ecosystem are very serious, particularly in developing countries. There is an urgency to resolve the issue quickly. EANET, Acid Deposition Monitoring Network in East Asia, has been monitoring acid deposition and related air pollutants among 13 East Asian countries. Recently, EANET expanded its scope to cover more air pollutants. By utilizing the data to be obtained from the monitoring based on the expanded scope, we can expect that more information can be obtained for gaining deeper insight into effects on human health and ecosystem. Today's seminar is divided into two sessions. First session is on scientific knowledge on the atmospheric environment and its effects, and the second one is on science-based policy experiences in other regions. In both the sessions, interesting and meaningful lectures are programmed. I hope common understandings on future directions of environmental measures between policymakers and scientists on national and international levels can be obtained in this seminar. Thank you.
Thank you very much for your warm and inspiring words. Next, we will hear from Mr. Bert Fabian, Regional Coordinator, UNEP Regional Office for Asia and the Pacific, who will provide welcome remarks. Mr. Fabian, the floor is yours.
Thank you very much, Dr. Sase and Dr. Shiro Hatakeyama. It's always a pleasure to listen to you. I think Dr. Hatakeyama has already made his very good opening remarks, providing us a brief background on the seminar for today. It is my pleasure. I am Bert Fabian, coordinator of the Secretariat for the EANET, to be part of this seminar. This issue on the impact of air pollution or acid deposition on ecosystems and health is very important. Almost every other week, and probably most of you who are in this online seminar will have seen new reports of the impacts of air pollution on health. I think the latest information, if you Google it, would be air pollution's impact on dementia, Alzheimer's, and Parkinson's disease. Over the last few years, we have heard how much percentage of the global population is exposed to high air pollution, and it's very high. There is a lot of information already available out there. Maybe what I'm trying to say is we hope that in EANET we can strengthen this science policy interface, but also reduce the time from science to policy to action. Many studies on impacts on ecosystem, forests, inland waterways, many studies on health, impacts on children, impacts on cognitive function, but the actions itself, it takes a long time. So we hope that with the expansion of scope, the EANET Project Fund mechanism, we will be able to move relatively quickly. In June 2012, the International Agency for Research on Cancer, which is part of the WHO, announced that diesel exhaust is carcinogenic. So we know that already, but despite that, this is 2012, many of our cities, our countries, we still allow very high levels of sulfur in fuel and high emissions of sulfur dioxide. So again, we know the impact based on consensus among scientists several years in the past already, but the action is not very quick. We've seen this in many things like lead in gasoline. In 1972, the US has banned lead in gasoline, but it took countries, almost other countries, many years, 10 years, 20 years, 30 years. Similarly for mercury. So maybe for EANET, we are an intergovernmental body, but we have a network of scientists, experts joined together. We hope that we can facilitate and improve on this science policy interface. Dr. Sase, thank you very much, and I wish all the participants and the speakers a very good seminar. Thank you.